It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is SHINE, Serving the Health Insurance Needs of Elders. And joining me today is Lance Jarvis, SHINE Co-Area Coordinator, Brevard County. Welcome, Lance.
Thank you, Joe. I'm very happy to be here and to share information about SHINE with your audience. SHINE is one of Brevard County's best kept secrets.
Well, we're trying to uncover that secret, Lance.
Yeah, much appreciated.
Well, you know, I remember the first time I asked you if you would be on a show, and you said, I would be delighted to be on the show, Joe. You were one of the most willing participants I've ever dealt with in all the years I've been doing radio and television. That goes back 16 years now.
Yes, you do.
You know, you often wonder, you had a previous career before you got involved with the SHINE people. I had a 38-year military career. We think about all the things in our past that can assist us in like a second or third profession. And this is sort of what it's amounted to. It's sort of my third career.
Yeah.
But it's fun. And I think what's really fun, Lance, is the ability to talk to panelists like you so that we can project thoughts that we have, experiences we have to our viewing audience so that you, our viewers, can appreciate some of the experiences that you and I have had that we hope will help our viewers understand not only their own particular situation, but situations of friends, family members, and, you know, being in a nonprofit and dealing with people that do the SHINE program, it's all about helping people.
Absolutely. That is our mantra. We're here to help people. Yeah. Our role as SHINE volunteers, and SHINE is an all-volunteer organization statewide with over 600 counselors who are there to provide information and counseling to Medicare beneficiaries. The program is funded by the Administration for Community Living, a very small amount of funding.
I was hoping you'd bring that up.
It's a modest amount because all of the 600 counselors are volunteers. There is only 4 or 5 staff in Tallahassee to support us. And so it's one of the taxpayers' best deals to have 600 counselors statewide available to help people with Medicare issues, questions, and decisions.
These are not just volunteers, though. They're a lot more than a volunteer, Lance. These volunteers probably are as well trained as any type of volunteer that or person that volunteers for a nonprofit organization throughout any of the states in the United States.
Well, I'd have to agree with you, Joe. Becoming a SHINE volunteer isn't easy. We very carefully screen those who show an interest in volunteering for SHINE. They go through a very extensive training program, after which they have to pass a test that demonstrates their knowledge of Medicare, Medicare options, Medicare rules, and Medicaid. In addition, if they pass the test, they go through FBI Level 2 background checks to make sure that their background is clear of any felonies or other incidents in their life that might cause us to have question as to whether they can be trusted to serve the clients.
And one of the reasons for that, I think, is because SHINE volunteers often deal very close with the families as far as their financial aspects, what their resources are, because you can't direct them to a good insurance plan that would best serve them if you don't know what they're capable of doing.
That's precisely right.
So tell our viewers exactly what does a SHINE counselor do?
Well, that's a wonderful question. Sometimes what we do is things other than what we are really our mission is. But let's talk about things,
the official thing first.
The official things are to provide counseling and advice to Medicare beneficiaries. And those are not necessarily people over the age of 65, Joe. That could be people who are on disability, and after they have been on disability, federal disability, for 24 months, they automatically get Medicare. And they have the same decisions to make as somebody who's turning 65. So providing counseling and advice to folks who are Medicare beneficiaries is the number one job. That's the number one mission. And when we do so, it's important to emphasize that our counsel is completely free. It is totally unbiased and objective. We don't sell anything. Unlike the seminars that are run by various health plans,
right.
We don't have any skin in the game, and the only thing that matters to us is the needs of our clients. So we're awfully good listeners.
Do you often find people are confused by that? Do people think that you do sell insurance?
Very rarely.
Really?
Very rarely. Most people come to us because we're objective, because they know that we won't sell them anything.
Okay.
So that's a
you work year round.
Yes, we work year round. Mm-hmm.
But you have what we call the open enrollment period, which is I'll let you talk about it. Talk about the open enrollment period, and then talk about what you can do at times other than the open enrollment period. And Medicare planning is a continual thing. So that's what I want our viewers to understand today from this show about SHINE.
Fine. Annual open enrollment period, the official annual open enrollment period for Medicare is from October 15th through December 7th every year. It's during this time that Medicare beneficiaries can make many changes in their coverage, such as switching from original Medicare to a Medicare Advantage plan, switching from a Medicare Advantage plan back to original Medicare, switching from one Medicare Advantage plan to another Medicare Advantage plan, a different one, changing their prescription drug plan. And so this is a very busy time of year for us. I'd say almost half of our client contacts are made during the annual open enrollment period. So it's a very important time for us, a very hectic time, but one we enjoy immensely because people have a deadline to make decisions for the following year. And any decisions that they make during annual open enrollment become effective on the first day of the following year. Now, your question about what can people do outside of the annual open enrollment period is a good one, because there are many things that people can do outside of annual open enrollment. For example, between January 1st and February 14th, Valentine's Day, people who signed up for a Medicare Advantage plan and find that it just isn't their cup of tea can switch back to original Medicare. Between January 1st and March 31st, people who are what I'll call late enrollees in Medicare, people who just chose, for whatever the reason, not to enroll in Medicare at an earlier date, can sign up for Medicare, Parts A and B, and that coverage will become effective on July 1st.
Is that a first-time enrollee?
Yes, a first-time enrollee. Thank you. Thanks for the clarification. But in addition, there are many things that can trigger what we call a special enrollment period for a Medicare beneficiary. For example, you move from Ohio to Brevard County. That triggers...
I was going to ask you about that. My question would have been, and maybe it'll help with what you're going to talk about. Does Medicare follow from county to county or from state to state? Or
Sure.
What happens?
Original Medicare does. Medicare Advantage, as a rule, does not. So people who have a Medicare Advantage plan in Ohio come to Brevard County. They're going to become permanent residents here. Will probably need to change their Medicare Advantage plan because the doctors in Brevard County are not going to be in the Ohio Plans Physician Network.
That's important to know.
That's very important. And many of the folks we help call us before they make the move to Brevard and say, hey, I'm coming. I want to know what my options are, and I don't want any lapse in coverage. And we help them with those sorts of decisions.
You just raised something. You said people call you. How do people know to call SHINE in Brevard from some other state? Is SHINE a national program?
Yes. SHINE is part of, this gets a little complicated. SHINE is Florida's name for a generic program called SHIP, State Health Insurance Assistance Program, that operates in all 50 states and 4 foreign territories. Each state has the prerogative to give the SHIP program its own name.
Okay,
so Florida chose SHINE.
SHINE? Okay.
And other states choose other names.
See, we always learn something.
Yeah, and there are various ways that people can learn about SHINE. One is if you, people who get the Medicare and You book, which comes out every year, will find out on the back cover their suggestion to call SHINE or SHIP. And
it's on the back of the book?
It's on the back of the book, and they can call a toll-free number and be told what the contact information is for the state that they want. The state of Florida publishes a newspaper called Elder Update,
right,
which always features an article about SHINE.
You have a column in there usually, don't you?
Normally a column written by me. And our outreach efforts also help, Joe. SHINE counselors not only counsel, but we go to health fairs, set up a booth, tell people about what SHINE is, what we do, and how to contact us in Brevard County. We also do presentations, various community groups. I'm doing one next week for folks with ALS. And I will inform them about SHINE, what we do, and some things about Medicare and their benefits, their eligibility for benefits.
These are people with Lou Gehrig's disease?
Yes, with Lou Gehrig's disease.
Is that a special type briefing you give for them?
It's a special, yes, they're special in the sense that while most people have to wait a considerable period of time to get Medicare, 2 years, after they are declared disabled, people with ALS are on an accelerated basis. They can get Medicare almost immediately, which can be a big help.
It goes back to the thing we keep talking about on our radio, our television, and our printed media. Information is knowledge and power. If people don't know about the benefits from SHINE, look at all the new things that you've come up with. For instance, and I want to ask you this question. You mentioned people going back from one Medicare Advantage plan to another during different enrollment periods. Do you find people switching back and forth very much?
Oh, yes. Many people do. And there are a number of reasons why they might do that.
But in Brevard County, we only have one Medicare Advantage plan.
We have 23 Medicare Advantage plans.
23?
Yes. There are 23 Medicare Advantage plans in Brevard County, offered by a wide variety of insurance companies that have a contract with Medicare to offer Medicare Advantage plans.
I thought there was only one HMO in Brevard County.
There are 23 plans.
Holy smokes.
So that makes the decision somewhat complicated, and people switch from one Medicare Advantage plan to another, If, for example, their primary care physician says, I no longer will be in the network of the plan that you have,
Okay.
but here are the other plans that I will accept for next year. And people who are very loyal to that physician may immediately switch plans.
Or more importantly, in this current day and age, with a declining number of physicians, we might want to do everything we can to make sure that we have a physician. So that might be why we want to go with the guy wherever he or she might move to.
Precisely.
But somebody else keeps sort of digging at me about when you talk about Medicare Advantage plan, and you talk about having to switch and having to do all this. I don't understand why anybody. I'm in standard Medicare, and I have TRICARE for Life as a secondary. But before that, I had a program called Med Plus, and I paid $1,200 a year for that, which is comparable to what people pay for a secondary insurance now on Medicare. Why would you want to limit yourself to a Medicare Advantage plan that only operates one place? Sort of an associated question. That's what they do in the presidential debates. They ask associated questions. Along with what I've just asked you, how do you mix in the fact that some Medicare Advantage plans operate only, say, in one county? But do the Medicare Advantage plans we have in Brevard County, do some of those plans cover people going outside of Brevard County? How do you know to look for this stuff?
You've asked a lot of questions in that, Joe.
Okay, how do you simplify that?
Well, let's first of all look at why people might choose a Medicare Advantage plan compared to original Medicare.
Okay.
Folks who have original Medicare will normally also have a prescription drug plan, a Part D plan, which has a premium.
Okay.
And they will have a Medicare secondary or Medigap, which is what you had,
right,
that you were paying $100 for. And believe me, there aren't many that you can still buy for $100 that have the coverage that you had. So that month to month can be a pretty big bite out of some budgets. There's the $104.90 or $121.80 in Part B premium. The average prescription drug plan has a premium of about $40, and the average Medicare supplement or Medigap policy runs somewhere about $150. So if you add this, we're talking about $300 a month.
Per person.
Per person. What you get for that $300 a month is the ability to go with original Medicare, is the ability to see any doctor that accepts Medicare anywhere in the United States and 4 foreign territories. You can go to any hospital, any physical therapist, any diagnostic center. So what you are getting with original Medicare is the flexibility to make choices however you want to make them for who provides you with your medical care.
But you've just said to have that flexibility, if it's a married couple, it's going to roughly cost them $7,000 a year.
Yeah, that's correct.
Okay, now what's the advantage of going with the Medicare Advantage plan?
Medicare Advantage plans work somewhat differently. They are offered by private insurance companies that have a contract with Medicare. They may provide no fewer benefits than original Medicare. So they get all the benefits that they would get with Part A and Part B if they had original Medicare. Most of these plans include prescription drug coverage, and the premium for most plans is no more than they are paying for Part B alone, $104.90 or $121.80. So the advantage is from month to month, the premium for a Medicare Advantage plan is far less.
It's almost $200 a month per person.
That's correct. With the understanding that with a Medicare Advantage plan, think of it as an a la carte plan. For almost every service that you receive, there is a copayment. Go to your primary care physician, it might be $10. Go to a specialist, it might be $40. Get an MRI, it might be $300. Whereas with original Medicare and the supplement, you might not have to pay anything out of pocket.
Oh, smokes.
So it can be deceptive to think that if you have a Medicare Advantage plan, you're always going to come out ahead financially, because if you use a lot of services, you're going to have a lot of copayments.
Or if you're traveling, you're in trouble.
Well, if you're traveling, and that's a really important question that we always ask SHINE clients. Are you going to be a snowbird? Do you plan on taking your RV and traveling around the country once you retire? Medicare Advantage plans normally cover a limited geographic area. A major plan in Brevard County covers 5 counties. You can get your Medicare care in 5 counties. Some plans cover the entire state. But people who are going to be traveling out west to Yellowstone Park and Lincoln, Nebraska, may find themselves with difficulty getting medical care unless it is a medical emergency. People with a Medicare Advantage plan can go to any hospital anywhere in the United States.
For an emergency.
For an emergency. But perhaps nothing more than just treating that emergency.
And you could get pretty sick and need treatment and not require emergency room treatment.
Yes.
So, I do shows about Medicaid planning, estate planning, financial planning, SHINE planning / insurance planning, healthcare planning is a topic that probably needs to be discussed more, because there are so many unknowns with that, Lance. And you sort of hit on that today, but we, on one part of one show, we talked about how SHINE does something similar to what Helping Seniors does. And that's since the SHINE counselors are trained to listen, you become a very good listener. And in fact, a SHINE counselor is in effect an information specialist, similar to what we have at Helping Seniors. And perhaps you can explain to our viewers why I want you to point this out about what SHINE counselors do that many people don't think about.
Sure.
A second ear.
Well, Joe, when people call us, the supposed reason for the phone call or for the appointment is a Medicare issue, most of the time. But as you listen to the client, you understand the Medicare question, and in some cases they're very easy for us to respond to and guide the individual to the solution to their problem. But it often doesn't stop there. Some seniors are very lonely, and you are a voice on the phone that seems to listen. And if you do so, you hear about other issues beyond just health insurance that is challenging that senior. For example, some seniors are very lonely. Some are, because of a disability, are unable to leave their homes. Others are concerned about their future. They'd like to remain in their home, aging in place, but they know that the house needs repairs, and they can no longer do all of the housework on their own. And so SHINE counselors often hear about many things going on in that client's life that go beyond a Medicare question. And we try our best to refer them to the appropriate resources in the community that can help them with the challenges that they're facing.
Yeah.
So that's one of the many things that SHINE counselors do, and we do it with great joy. It's a privilege to be able to help our seniors.
Well, it's extremely important because the federal government has started a new program called Accountable Health Organizations. and it's part of the Affordable Health Care Act, and they're going to pump $157 million into this program to do a 3-track program. 1 track on awareness, 1 track on navigation, and 1 track on alignment. And we've met with Kindred Hospital and Wusthof Hospital as a possible consortium to apply for a multi-million-dollar grant to help seniors in Brevard County. And it's ironic that Helping Seniors in 2011 was formed for the purpose of information, education, and connecting to resources, which is exactly what this new program that they're investing $157 million into is going to do. So maybe we can take what we've learned and channel that into helping somebody. But what's gratifying to me, Lance, is to know that there are people that are willing to give of their time to help people navigate a very, very complex system. And I would imagine you still get people calling and about Medicaid when they mean Medicare.
Oh, all the time. All the time. They don't know the difference between Medicare and Medicaid.
How do you think we will ever educate people to the fact that Medicare is not a long-term care program and Medicaid is, in fact, a long-term care program? How do you do that?
I don't know, but we sure do our best to make sure they understand the difference and what resources are available to Medicaid, people who are eligible for Medicaid and don't know quite where to go to get that help.
We're almost out of time. What would you say was one of the single most highlights of your SHINE camp? So you got about 20 seconds.
20 seconds isn't enough. Every day is a new experience, a new challenge, and a new delight in assisting clients. Call 321-752-8080 to reach a SHINE counselor in Brevard County.
You hit it right on the nose. Thank you. Right. And I want to thank you, viewer, for watching today's episode of Helping Seniors. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.